Well, I'm happy to be here, and like Maria said, over-the-counter medications, huge area. When we got started going, it just took on more and more and more, and I wanted to make sure we got everything in. So it will be a couple of presentations. I am a pharmacist. I'm a geriatric specialist pharmacist, which just means I took some extra training and do ongoing training to really learn about how geriatric people metabolize medications, what interactions they might have, and how to really dose them appropriately. I'm also a pharmacotherapy specialist, which is someone who can look at an overall medication regimen and see where there might be some issues. But most importantly, what that means is that I like talking about medications. And so I'm happy to talk with you today about over-the-counter medications. We're going to have a little overlap where I refer to some prescription medications, and that's mainly because I feel that there's a couple things that are so common that they might have to be mentioned, but it's really over-the-counters that we are focusing on. But specifically, we're going to talk a little bit about grapefruit juice. That's been in some commercials lately. Tapering medications, sunlight and how that can affect you with medications, expired medications, dangers of some over-the-counter medications, herbals, and herbals is really a presentation in and of itself. It's a hard deal to talk about herbals, so it'll be a quick list, and interactions with some drugs and interactions with some diseases as well. Now, over-the-counter medications, you probably know this, are called OTCs, to stand for over-the-counter. You'll see a nice section related to that in almost every drugstore. And they're medications that do not require a prescription, and they can be bought by going into a store and just grabbing things off of the shelves. Some of them used to be prescription items, such as Prilosec, which is also called omeprazole. I think we're probably all familiar with that one. It's an acid reducer. Now, these over-the-counter, these OTCs, are slightly different than the behind-the-counter items that contain pseudoephedrine. Those are the ones where you go and buy cold or cough medicine and you have to show your ID and sign for them to make sure that you're not making methamphetamine. So that's what that's all about. They're a little different, but they're all available without a prescription. The thing about over-the-counters that I think is really important to know is that they can change. They can have different active ingredients with the same brand name, and there's usually not a lot of fanfare or warning. Now, the FDA knows that they're changing labels, but how often do you see a commercial where they come out and say, we've changed our formula and now it contains X, Y, and Z? You don't see that very often, although I wish that we would see that pretty often, because it'll change and you'll think I'm taking the same thing and it won't work the same way, and you'll wonder why, and that's why. One of the best examples is kaopectate versus Pepto-Bismol. Kaopectate, and this is an old example, but a lot of people still don't know, kaopectate used to be kaolin and pectin, but now it's bismuth subsalicylate, which is actually Pepto-Bismol. It's not pink like Pepto-Bismol, but it is, in fact, Pepto-Bismol. So that's important to know if you have allergies or you're expecting a particular kind of reaction from a medication that you're not getting. Now, Midol is something that some people take for pain, but guess what? Sometimes it has a diuretic in it. That's important to know if you're taking other diuretics. Some have it, some don't. There's different versions of Midol. There's different versions of migraine medication. Some of them have caffeine in them. Some have caffeine, Tylenol, and aspirin in them. So if you're taking other medications for pain, it's important that you know what is in these medications. And like I said, it can change. You might have a special migraine medication that's marketed one way, and by the same company, a different one, and you have no idea what you're actually getting unless you're reading the labels. Some label changes recently for OTCs have talked about grapefruits, and there's a couple commercials out there right now talking about grapefruit juice. The thing about grapefruit is that it has compounds in it that can interact with medications in the stomach and in certain amounts in the liver. There's flavonoids, there's furanocoumarins, and a dietitian can probably tell you more about the exact things that interact, because there's been some debate about that. But it's important to know that what it does is it interacts with things in your liver and in your gut. There's the cytochrome 3A4, P-glycoprotein, organic ion transporting peptide, and what that really is, in big words, are filters, just like a coffee filter would keep things from going down into your coffee, and essentially a catalytic converter like you would have in a car, something that changes one thing into another thing. So that's what these things are in your gut and in your liver that get blocked by grapefruit juice. The ultimate result is that you might have higher levels in your blood than might otherwise be expected. The problem with that is that it's hard to know which ones and why. Allegra is the most common over-the-counter medication. It's an antihistamine for allergies, and the manufacturer specifies that you should separate Allegra for about 4 hours from grapefruit. There's some prescriptions that I've mentioned here: levothyroxine, amiodarone, cyclosporine, some blood pressure medications, some anxiety and sleep medications, some cholesterol medications. And what you really have to do is work with your doctor to figure out if they're affecting you, because a difference in levels in the blood versus difference in clinical outcome is completely different from person to person. They did studies in blood pressure medications that showed at different time points what happened to your blood pressure if you had taken grapefruit juice and these medications. And for some people it varied a lot, for some people it varied a little, but some people it was just the level. So perhaps the level was higher, but their blood pressure was the same reading either way. Other people, the blood pressure was much lower, the level was much higher. So you really have to pay attention to how you're feeling, what you're eating, and try to separate that out to see if it's affecting you. Some drugs in general, though, will say to separate by 2 or 4 hours. Levothyroxine, which is a thyroid medication, Allegra, about 4 hours. Some say to just avoid it altogether, to not drink it. Amiodarone is one of them. The statins, which are cholesterol medications, are another set. I have to say I love grapefruit. I would be just so upset if someone told me I couldn't have grapefruit juice at all because of a medication. And there are cholesterol medications and other medications in most cases that you could take so that you could still have grapefruit juice if you love it as much as I do. So don't feel like you're just doomed and you can never have it again. And in moderation, most things are okay. Most of these things aren't something you have to worry about, but there are some cases where you should pay attention and really pay attention to the side effects. Look at the labeling on the packages. Look at the labeling that your pharmacist gives you when they give you medications. If you are having some of those reactions and you've been drinking grapefruit juice, it's probably because those levels are a little higher than they should be. One of the questions I get a lot and every pharmacist gets is, can I take a drug if it's expired, and what will happen if I do that? Everything, soda, soup, everything nowadays has an expiration date on it, and there certainly is the thought that the manufacturer does that just so they can have product turnover and you'll buy more. And some of that may very well be true. But the thing about the expiration dates is it's when they've tested out to a point to ensure potency and stability and sterility of the drug. And it's impractical for a manufacturer to keep a drug on a shelf for 20 years under the same conditions and test and test and test and test before they market it. So, you'll have a certain amount of, 5 years, 4 years, 3 years. That's about a standard. Beyond that, not so much. Stability, I just want to talk about, is the drug the same as it was when they packaged it? Sterility is, does it have mold in it? Does it have rat feces in it? Has it broken down into something gross and disgusting with bacteria? These things can happen, usually based on storage. And I don't know about you, but I'm, even as a pharmacist, not constantly checking the storage conditions of all of my medications at home. I probably should be, and I try to keep them in a cool, dry place. But we all err from time to time, so you really want to pay attention to those expiration dates. It really depends on the medication as well. Tetracycline, which is an antibiotic, nitroglycerin, that's the medication you typically put under your tongue or you spray in order to decrease chest pain, insulin for diabetes, some breathing treatments, specifically Zofanax is a big one, and then liquid antibiotic suspensions. Suspensions are the ones where the powder settles to the bottom and you have to shake it up really hard to get it to work. A pink one, amoxicillin, is a really common one. There's a yellow one as well that are super common. Those are the ones where we're thinking once it gets past an expiration date, and that's not even necessarily the manufacturers, it's after it's been out there for a year, for 14 days, if it's an antibiotic suspension and the pharmacy puts that on there not to use after 14 days, you probably really don't want to use it because it can break down, and usually it becomes weaker, although with tetracycline there have been a couple case reports where it really became something else, and then there were toxic events. So, you have to worry about what you're putting in your body and what you want it to do, what your goal is. If it's weaker, it's not going to work as well, especially if it's an antibiotic. Now, room temperature is a specific storage condition. It's not, I'm in a room, my medications are in a room, and as long as we're together, it's all the same. Like if you take your medication to the car, it's not going to be the same as it was in a cool, dry place in your house. If you have it in your bathroom, there's a lot of moisture there. If you have it in your refrigerator, oh, I know we love the refrigerators, but the refrigerator is for food. It's to help your food not have bacteria and mold grow as fast. For medications, it's just exposing it to moisture, and you have to think that moisture is the enemy of chemical stability because you have binders in there and inactive ingredients. Some of those are specifically designed to attract moisture from the air under specific room temperature conditions. You put it in something colder that's super moist, you're going to be grabbing moisture out of the air all over the place. It may start to break down sooner than you think. Tylenol. I don't know if you guys have been aware in the press of Tylenol, but Tylenol is hot and heavy right now in the press. So Tylenol is also called acetaminophen. It's also abbreviated APAP, in case you see that on some labels or on a prescription. The FDA says that consumers are not sufficiently aware that acetaminophen can cause serious liver injury, and their perceptions, the consumers' perceptions, may be influenced by the marketing of the products. And I think that's true. I think everyone's influenced to some degree about marketing, and I think it can be confusing. Right now, this fall, 2011, this is some big deal going on with Tylenol, and we'll get to that in a minute. But first, the toxic doses, they might be lower than the label says in some cases. They might be lower than what your doctor is telling you to take in some cases, because it's not only about the dose, it's about whether you have a liver issue. It's about how much alcohol you drink in a day. It's about how many other kind of medications you have that filter through that same filter in your liver, that same catalytic converter. The dose, the combination of items may overwhelm the liver, and then you'll have to switch to a different pathway. And your liver knows once it gets to a certain point, you switch from pathway A to pathway B. The problem with pathway B is bad stuff comes out of it, and it can cause liver failure. So it's there as a backup. We don't want to go there all the time in the liver, and that's why dose and combinations are so important. And you may have seen some product labeling that says this product, contains acetaminophen. Severe liver damage may occur if you take more than 8 caplets in 24 hours or 12 of the 325 milligram tablets in 24 hours. If you're taking the acetaminophen with other drugs containing acetaminophen, if you've got 3 or more alcoholic drinks going on every day while you're using that product. That's going to change. Fall 2011, McNeil, brand name Tylenol, which is just your brand name, we've got a picture of it up on the slide here, is going to change their directions to say that the maximum dose will be 3,000 milligrams per 24 hours. The current dose is 4,000 milligrams per 24 hours, so they're really reducing it by 1,000 milligrams. And McNeil did this and then notified the FDA. That's how that went down. The FDA didn't come to them and say, you have to do this, although it has been in debate. But McNeil really took the bull by the horns here and said, this is what we're going to do for our consumers for safety. And I think they did a great, great job. In 2012, McNeil, the brand name Tylenol people, will lower the maximum daily dose for the regular strength Tylenol as well. Right now they're just doing the 500 milligram, the extra strength. Then they're going to roll out the 325 milligram, the regular strength. And again, that maximum dose is going to be 3,000 milligrams per 24 hours. What they said, though, is that consumers can continue to use their Tylenol and other adult acetaminophen-containing products as currently labeled. So right now you don't have to do any radical changes. But this is another reason why you shouldn't store medications around until they expire, because that labeling is going to stay the same in your cabinet, but the labeling on all the new stuff is going to change. So things like this happen, and you don't want to be taking toxic doses when you shouldn't be taking them. Now, the company is working closely with other manufacturers of acetaminophen products to help ensure consistency in dosing instructions. And what that really means is that brand name Tylenol is doing this, but guess what? Generic people who make acetaminophen are going to follow suit. The Tylenol website has been enhanced to include interactive tools to help consumers identify products that contain acetaminophen, and there's a website up there that you can get to. And they list common products that contain Tylenol that they make and some prescription things. The best thing about this website, though, is that it has this little place where you can type in anything you're taking, and it will spit out whether or not that contains acetaminophen. And it doesn't have to be something that McNeil makes. It can be anything that you're getting from prescription, anything like that. So I played with it a little bit, and it is really fun. You can put anything you want in there, and then you'll know, in order to be safe, are you taking too much acetaminophen? The McNeil people. They also make Tylenol PM, has Tylenol in it. And one of the things that we battle when I'm doing chart review is Tylenol PM or Advil PM. It seems so safe. It's just over the counter. There's lots of commercials for it. It's nice. We like it. It's friendly. We know the names. The problem is the active ingredient is antihistamines. And antihistamines have side effects. Basically, it's how most people feel when you take Benadryl. I think we've all had some Benadryl and felt that sleepy, groggy feeling. And this is the active ingredient in most of the sleep aids. So Unisom, Tylenol PM, Sominex, Nitol, they contain diphenhydramine, which is Benadryl. That's the generic name for Benadryl. Or they will contain doxylamine. Now, doxylamine is basically Benadryl's big sister. That's what that is. They act the same way. You're going to get the same side effects. It's not necessarily safer or better. And some of them, as we've mentioned, have Tylenol, which is acetaminophen, or Motrin or Advil, which are ibuprofen. So what do these antihistamines, what do diphenhydramine and doxylamine do? They basically block the effect of histamine, which is a neurotransmitter, and they help you feel sleepy, but they have other side effects. No one on the planet, no matter what they say, has gotten to the point where they've manufactured a drug that only does what you want it to do and doesn't do anything else. They all do something else. So this will give you dry mouth, dry eyes, blurry vision, unclear thinking. You might become more slow-moving, especially if you're taking Parkinson's medications. It can counteract those. Urinary retention, which can lead to urinary tract infections if it goes on long enough, and constipation. And I can tell you this is not just for seniors. I actually bombed a very significant test my first year of pharmacy school as a result of taking a sleep aid a little too late, and I was still under the effects during the test in the morning. I couldn't think, I couldn't focus, I had studied for a long time. Medication side effects. So they affect everybody. Now, the Tylenol PM and the Advil PM, they contain these other medications. If you don't need other medications, don't take other medications. I know it's laying around the house and you bought it for sleep and once when you had pain, but if you don't need extra medications, try not to take extra medications. If you're taking something once in a while, it still has an increased fall risk. So you want to balance that with your need for sleep. If you're on vacation and you're going to be walking around a lot the next day, or you're going to be going out, you might want to think, am I going to feel a little unsteady? Is it going to counteract my Parkinson's medications? Is it going to counteract my memory medications? Is it that important to me tonight to take this medication? And it may be. You know, there's a risk-benefit. It affects your driving. We all have heard people getting pulled over and having accidents because they took Benadryl. Hangover effect, I had that with that test I mentioned. Increased fall risk, it affects your memory, causes confusion, and thinking problems. It really can counteract memory-enhancing medications. I think people discount this, but it absolutely does happen. So if you are taking medications to help you, if you've been diagnosed with dementia, you want to think about how often you're taking these medications and how it's affecting you, these over-the-counter Tylenol PM or Nitol, those kind of things. It can also cause dependency, tolerance, and rebound insomnia. Now, dependency isn't like you're an addict. It just means it's a crutch that you're using and you're going to fall asleep easier with it than you would without it. Your body gets used to that. Tolerance means you might have to take more and more doses. I mean, I've had people taking 5, 6 Tylenol PM a night, which first of all is too much Tylenol, and second is way too much antihistamine, but they get used to it and they think it's safe. So that's not appropriate. And you'll get rebound insomnia. You will get rebound insomnia. It's because you've used this crutch. It doesn't mean that you will never fall asleep on your own again and you need to take these medications all the time. I'm someone with chronic insomnia, have had it since I was in junior high. And when I'm taking these medications, it's for short periods of time, and when I stop, I know I'm going to plan it. I'm going to plan it on a weekend when I don't have to get up and go to work the next day because I'm going to have rebound insomnia. It's going to take you a few days to get back to normal, to get your body ready to help itself go to sleep. And we have a little importance of sleep for seniors link here to help you guys if you want to watch another presentation on that as well. Some other sleep aids that are, I'm going to put this in quotes, natural, that are natural for you are melatonin, and it's a hormone. It helps control your natural sleep-wake cycle. It's best associated with people who do shift work to help maintain their circadian rhythms, or people who have had jet lag, but other people are using it now too to help them sleep. It is effective, and it's sort of natural, but everything was once based on a natural substance, and I have never gone out to my garden of herbs and picked a pill off of one of those. So something that is in pill form isn't so much natural. It's based on something natural. It's a nod to something natural, but natural things look like natural things. They look like plants. They look like dried herbs. Pills, not so much. It also interacts with things. So blood thinning medications like warfarin, sometimes it's called Coumadin, immunosuppressants, diabetes medications, birth control pills. That's a big one. People might want to think about that. Sleepy time tea, that's an herbal. Regular sleepy time tea has chamomile in it. It's an herb. It's nice. Sleepy time extra, it has, right now I think it has a big extra. They keep changing their labeling. And right underneath the big extra is valerian root, like little tiny. It says valerian root. Well, valerian is a central nervous system depressant. It's a plant, but we're doing an extract here, so it's in a pill form. It's a muscle relaxant, and it may affect your heart vessels and your heart rhythm. If you have a heart condition, I would think really long and hard before taking this. Also, if you have a liver problem or you drink a lot of alcohol, I would be really careful, and there's no judgment here about the alcohol, but just acknowledge that that's what you're doing and try not to take this medication. Liver toxicity has been associated with the use of valerian in herbal remedies. Now, it's usually multi-herbal remedies where there's a ton of herbs in this one pill, but there are a couple case reports out there of people trying to commit suicide using valerian and almost getting there. There's a little website here that we have up about the FDA and dietary supplements that I think is excellent. The most important thing to do, and again, this is close to my heart because I have so much trouble sleeping, is to find out why you can't sleep, and you have to practice good sleep hygiene. Basically, you have to figure out what the contributing factors are, what helps you relax, and do that as much as you can without taking sleep medications. Now, I'm going to confess to you right now, I take sleep medications, but I am in the process of weaning off right now because it's been a few months, and that's too long. You can check your reflux to make sure that you're not sitting there and having just that terrible gassy burning feeling. That can make you feel terrible and you can't sleep. Restless leg, I want to take a minute and say this. If you are taking any medications that are for depression that are being advertised on TV right now to help with another depression med, these are antipsychotics. If you suddenly aren't able to sleep because you're moving, this may be the sign of a very serious side effect that can be permanent. So I want you to go to your doctor and have them assess. They have specific assessments they can do. Have them assess if that's what's going on with you or if it's just restless leg. If you are exercising too late, I can do certain exercise at night. I can walk, I can do an aerobics, but if I'm lifting weights at night, forget about it. I'm up for an extra 2-3 hours. If you have breathing issues or sleep apnea, if you're getting side effects from other medications, those over-the-counter migraine medications that might have caffeine in them are a big deal. If you're drinking caffeinated beverages, if you're drinking sport or vitamin drinks that have guarana in them, that's a stimulant. It basically is metabolized to caffeine. If you're having something that has dandelion root extract, this one got me. It's a diuretic. It sounds fabulous. It's dandelion root extract. How bad could that be? Well, it made me have to go to the bathroom all night, and I couldn't sleep, I'll tell you that. So, and it can dehydrate you and cause you to have drops in blood pressure, so be careful there. Depression in general, some depression medications, as a matter of fact, anxiety, taking long naps during the day, if you're traveling a lot, if you're after a certain age, and there's no specific age, it's different for every person, and you're drinking as much caffeine as you used to when you are younger, that might be a problem because people don't metabolize caffeine the same as they age. So you might be able to drink 5 when you're 20 cups of coffee, and now it's 2. And if your partner is maybe causing you some trouble with snoring or schedules, that's something to consider with sleep hygiene as well. As I mentioned, herbal remedies and interactions are something I want to talk about, but it's getting very long, and we want to make sure that you can ask us questions. So we are going to do another presentation on all of that information. And herbals, oh my goodness, herbals are so important to talk about. But we're going to stop here, and we're going to go ahead and think about taking some questions from you guys. And thank you for listening to me speak.
Thank you so much. We have received a couple questions today, and so I'm going to just read these off to you. And if you could answer them for us, that would be great. So you can step right in here
sure.
with me so we can see. One of the questions that we received today was about Benadryl. And somebody wants to know if that is on the beers list, and could you talk about the beers list for a minute?
Oh, that's a great question. Who asked that? That was excellent. The beers list is a list of medications that are recommended. They're not prohibited, they're not contraindicated, but they're recommended to not take if you are a senior. And the reason why is they can contribute to very specific side effects, most often associated with decreasing cognition and increasing fall risk, but for other reasons as well. It was constructed by a doctor who recently died, actually, Dr. Beers, and a panel of other people, including pharmacists, and it's been updated over the years. But this list is actually available. You can look that up on Google, and it will give you the full list, most updated list, which I think was a couple years ago where they updated that, and it's got such good information on it. And you can always take that to your pharmacist and say, hey, you know what, I think I'm on some of these medications that are on the beers list. Should I stop taking them? What should I do about that?
Next question is about the cholesterol meds, Simvastatin, and grapefruit juice.
This one's a little tricky. There is some literature that suggests that particularly Zocor actually does not interact with grapefruit juice. Much more literature suggests that it does. The manufacturer, I think at this point, is saying that you shouldn't take it with grapefruit juice at all. So if you are taking that drug, maybe you don't want to have grapefruit juice. There are other drugs in that class that you could take if you are a grapefruit juice lover. I love my grapefruit juice. I mean, I'm not drinking 5-6 glasses a day, but I'm drinking 1 or 2. So I would certainly switch to that if I were having a cholesterol issue. The thing to know about Zocor right now, also called Simvastatin, is that there's labeling changes going on because we've seen, especially in older people, a huge increase in rhabdomyolysis. And what that is essentially muscle cell death in your large muscle groups. And it's a known side effect of all of these medications in that class, that cholesterol class. The problem with it is that we were seeing high doses. You know, you always want to go to the maximum effective dose or the minimum effective dose depending on the medication, and we were pushing for the maximum dose. And in certain populations, elderly people, people of Asian descent specifically as well, they were having increased side effects. So given that and the controversy around grapefruit juice, I would avoid grapefruit juice with that medication absolutely, because there's just so much we need to learn about that. And you don't need muscle death. That can progress to actual death.